Good morning. Thank you for coming out today. Connie Mendel, Chief Health Strategist here at Louisville Metro Public Health and Wellness. We are here today to announce the Lead-Safe Housing Rental Registry is now online and available for rental property owners to register and document their properties as safe from lead hazards. That's the important part. We want to get to where all of our rental property is safe from lead hazards. So the registry is rolled out in phases and will eventually encompass all rental properties built before 1978. And why 1978 is important. That was the year that lead paint was banned for residential use in the US. But we know a lot of homes built prior to 78 has both paint, external and interior paints, both with lead. So the goal of the registry is to prevent and protect tenants from lead hazards and preserve safe, healthy rental housing. Lead is a naturally occurring heavy metal which is toxic to people, especially developing children. Children under the age of 6 are at greatest health risks of lead. And pregnant people can also be affected by lead, and it can pass that lead on to their unborn child. So there is no safe level of lead in someone's blood, and there is no cure for lead poisoning. So lead can enter the body when someone inhales or ingests particles found in lead-contaminated paint, dust, soil, or drinking water. So it's not necessarily the children eating lead chips, which can happen, but it may be opening and closing of windows and doors where it creates lead dust from that old paint. So this lead enters in the brain, the nervous system, can cause severe behavioral and learning issues, speech problems, slow growth, and slow developmental. Lead is more commonly found in older homes, which is why we're focused on those pre-1978. Louisville Metro has a lot of older homes and historic homes where lead-based paints still exist. Data shows that children living in the northwest area of the city are almost 10 times at greater risk for developing lead poisoning compared to children living in other areas of the city. So from 2005 to 2021, nearly 10,000 children in Louisville tested positive for elevated blood levels. Because of this ongoing health issue, the Louisville Metro Department of Public Health and Wellness and the Childhood Lead Poisoning Program has been around for more than 50 years. So when a physician identifies a child with an elevated blood level, our team works with the child's family to identify possible sources of lead in and around their homes and works with them to minimize lead hazards and to prevent that exposure to lead. So this registry further propels the work that we've been doing, and this is a giant step because we're actually moving to preventing lead poisoning. Instead of it waiting for a child to be referred to us, we're actually preventing lead poisoning and making homes safe. So again, there's no cure for lead poisoning, but it is preventable. And landlords and property owners who proactively address lead and these safety concerns are not just providing shelter, they're cultivating a positive living experience that fosters tenant satisfaction and loyalty. Everyone in our community deserves to have a safe and healthy place to live and the ability to learn and thrive. So now I'm going to ask Patrick Rich, our environmental health administrator, to come up and share more details about the lead registry itself.
The registry was created by an ordinance approved in Metro Council back in 2022, and it went into effect on December 1st this year. We are now accepting the rental registry portal online for people to log in and register their homes. If it is a rental property in the city, the ordinance requires all property owners to register their property if it was built before 1978. Now, the lead-based materials have to be remediated. They can be done either through encapsulation or abatement or enclosure. We can go into more of that later. As far as making these houses lead safe for people, we want to make sure that everybody is offered a home that is not going to subject their family to any sort of adverse reactions from its environment. So the lead-based materials have to be discovered in a lead-based risk assessment, and they need to be done by a certified lead contractor. Current prospective tenants should also be told about any lead hazards found in a property and how that abatement and remediation has been taken care of. Landlords will be required to document all the inspections and all the work done on a property. That way we can go back in and verify the work was done in a safe and effective manner. Property owners have a 1-year grace period to get these into compliance. So started December 1st, we are accepting anybody whose homes were built before 1940. Those will be up until November 29th of next year. And then we will roll into the next set of housing, which will be from November 1940 to 1965. That will help us not only to be able to control the amount of people we have submitting applications, but we will also be able to make sure we're doing a standard job of going out and inspecting these, making sure they're done properly. After that, November 30th of 2026, the next section will go into effect. Anything built from 1966 up to 1978 will be on that registry. Any rental unit that has a child with an elevated level will be required to be inspected within 60 days. That's something we've done for years with the Childhood Lead Poisoning Prevention Program. Any child with an elevated level above 15 automatically gets an inspection, and this is just something to kind of help move that forward, because we do want to make sure we are prioritizing anybody who is at immediate risk. Now I want to introduce Dr. Brian Gwynn with U of L's School of Public Health and Information Sciences. He's worked closely with us and done long-term research on the environmental lead exposure and its effects on health and human behavior.
Thank you, Patrick. Thank you, everyone, for allowing me to speak today. My name is Brian Gwynn. I'm Assistant Professor of Epidemiology at the School of Public Health here at the University of Louisville. I began researching the effects of lead exposure because of its profound yet preventable impact on human health, especially in vulnerable populations like children. Lead exposure is a silent threat, often unnoticed until it's caused irreversible harm in our children. Things like cognitive impairments and developmental delays. I think we're all here because we want to create a community where everyone has an opportunity, regardless of their socioeconomic position, to live, grow, and thrive in a lead-free environment. Unfortunately, every year 500 children are found with an elevated blood lead level in Jefferson County. And as Connie mentioned, the overwhelming majority of these children grow up in the northwest corner of Jefferson County in older urban neighborhoods where the majority of homes were built before 1950. This, by default, puts those homes at increased risk for environmental lead. The two primary sources of lead in the environment comes from lead-contaminated topsoil and remnant lead paint found inside or outside of the home. This past year, with my research colleague, Mr. Nick Herring, we've had the opportunity to survey about 100 homes in these neighborhoods. We found that 90% of these homes have what the EPA would define as lead-contaminated topsoil, and 67% of these homes have lead hazards on the exterior surfaces of the properties. By our estimation, Louisville has thousands of properties that are dealing with some type of lead contamination. Lead exposure often disproportionately impacts low-income and marginalized communities. This exacerbates existing inequities and creates cycles of disadvantage and harm for the children in these communities. Children exposed to lead may struggle academically and socially, leading to fewer opportunities and lower economic productivity as adults. This reduces the overall potential of the community, limiting its growth and development. Furthermore, untreated and ongoing lead exposure perpetuates health and economic burdens for future generations as families and systems are left to cope with the legacy of lead. Addressing lead poisoning is not just a public health priority, it is a vital step towards fostering equity, breaking cycles of harm, and ensuring a healthier, more sustainable future for our children. And this is why I'm so excited. I think we're all excited about the Lead-Safe Housing Registry. We're excited because at its core, it engages in primary prevention. That is, it keeps children from ever being exposed to the lead hazard. That's the great thing about this registry. There are other great things about this registry. It empowers residents. The registry provides tenants and homebuyers with information they need to make safer housing choices, empowering them to avoid homes with potential lead hazards. It also encourages landlord accountability. By requiring landlords to ensure their properties meet lead-safe standards before being listed, the registry motivates property owners to address lead-based hazards proactively, again creating safer housing practices. Preventing lead exposure through safer housing reduces healthcare costs associated with treating lead poisoning and its long-term consequences. It also minimizes the broader societal costs, like special education services and lost productivity, not to mention a myriad of health consequences associated with lead exposure. The registry raises awareness of lead hazards in housing, encouraging both residents and policymakers to prioritize lead-safe environments and invest in public health infrastructure. By integrating housing safety and public health initiatives, Louisville's Lead-Safe Housing Registry plays a vital role in preventing lead poisoning and fostering healthier communities. And if I can add here at the end, there is no safe amount of lead in the body. From 2005 to 2021, we had 10,000 children identified with some degree of lead poisoning. That's a heck of a biography to burden, but that doesn't have to be our city's destiny. And I think this lead registry will go a long way in protecting children in the future.
Dr. Gwen, thank you. Additionally, Metro United Way has been a great partner in this work. So now I want to invite Ashley Brand, the Director of Thriving Kids at Metro United Way, to come up and share more about the great work the organization is doing.
Good morning. I'm going to lower that a little. Good morning. Thank you, Connie, and thank you to LMPHW for inviting me to be a part of this exciting announcement for our community. And thank you to Metro Council for passing the lead rental registry ordinance in 2022, leading to this work that just launched this month. In 2022, Metro United Way and the Ready for K Alliance, a coalition of over 100 community partners focused on ensuring all children in our community can thrive, we're proud to be partners in the development of the registry ordinance and advocate for its passage. Now, 2 years later, we are looking forward to supporting the city in a successful rollout and implementation of the strategy. We applaud Metro Council and LMPHW for being proactive on this issue that has the most significant impact on our community's youngest residents and has lifelong repercussions. At Metro United Way, we work to ensure that Louisville has thriving kids, strong households, and equitable communities. Safe and healthy housing is key to reaching all of these goals. Children and families cannot thrive when their own home is poisoning them. And while there is not a cure for lead poisoning, as we have heard, it is preventable. We as a community need to move towards solutions to prevent lead poisoning before it happens, and the Lead Rental Registry is one way we can achieve that. In 2023, Metro United Way was awarded a grant from the Centers for Disease Control and Prevention, also known as the CDC, to support lead poisoning prevention in Louisville. With the support of CDC funding, Metro United Way facilitated the development of a community-wide lead-safe strategic plan. This past August, over 40 community partners convened to develop this plan, including housing advocates, local council members, state legislators, public health officials, and early childhood experts. And from that convening, we now have Louisville's Lead-Safe Strategic Plan. In January 2025, Metro United Way, serving as the backbone for the strategic plan, will launch the work outlined in the plan in partnership with local and state government, nonprofit partners, and individuals in our community who have been impacted by lead. The successful implementation of the rental registry is key as a key component of Louisville's lead-safe Louisville strategic plan. But one individual program, organization, or ordinance alone cannot achieve what is needed to prevent and address lead poisoning in our community, which is why Metro United Way and the Ready for K Alliance prioritize partnerships. For every child and family to thrive, institutions, services, and organizations must be comprehensive, collaborative, aligned, and coordinated. We look forward to working with and supporting the city and LMPHW in a successful implementation of the lead rental registry and invite the community to join us as we launch Louisville's Lead Safe Strategic Plan in January so that we can ensure all children in Louisville can thrive.
So for more information about lead-safe housing registry, visit our Lead Hazard Reduction Program page at louisvilleky.gov. To learn more about Childhood Lead Poisoning Prevention Program, visit stopleadlou.com. And before we go into questions, I also want to recognize the great partnerships that have brought us here today. So we want to thank Metro Council certainly for creating the ordinance, the Metro United Way, Lead-Safe Louisville, U of L's Dr. Brian Gwynn, Louisville Metro Codes and Regulation, the Metropolitan Housing Coalition, Microanalytics, the Louisville's Tenants Union, IDLX Lab, and former Metro Council member Cassie Chambers Armstrong for their collaboration to help develop the Lead-Safe Housing Registry. So now we can move on to questions, and then if you want to stick around, we'll have a demonstration of a lead test.
Guys, what happens to landlords who maybe fail to address the lead, or to homes where they maybe fail to address the lead?
Come on out, we can answer together. So as we talked about, it is being rolled out in phases. So once the phase begins, there's a 1-year grace period before enforcement begins.
Correct.
And
Yes.
what you go into.
Yes. So the point is to make sure we get these houses into a safe mode. So once somebody goes out and has the inspection done, they're going to have a lead hazard control report, which will have what efforts need to be taken to make that house lead safe. If someone gets that control report and does not act upon it and make their house lead safe, at that point we do have a citation in place to make sure that those do get brought in. Generally, in the past, that's not been an issue when we found lead in a property because we've been doing this lead work for years. This is just the first time we're actually proactively going out and doing it without an elevated blood lead level from a child. So generally, people are very good about getting these done. I don't expect we're going to have a lot of people not getting their houses checked because I think our city does care about its tenants. But there is protocols in place for if we do have some bad actors who come around and do not want to fix their houses.
It's very like in cost or amount. Would the situation dictate the citation?
Yes, the citations will be based on whether it was non-compliance at all to not get your house inspected, or if it was you found you had both lead in your soil and lead in your paint and you only addressed the lead in the paint. Those citations would vary. They would compound based on repeated non-conforming. Then at that point, eventually we could put a lien onto a property.
Codes and regs.
Yes.
Yes, sir. Have you started seeing registrations roll in yet?
Not yet. We're hoping. We're hoping today. We're hoping with this today we'll have some people. We've been live for over a week now. We haven't had our first registration come in. We have had lots of calls asking about the registrations and how they work. But the way the program is set, you're supposed to have somebody come out and do the inspection first. And then once the inspection is done, you have the work done to remediate the lead. So we didn't expect a big landfall to come in at the beginning. We expected people to really start reaching out probably beginning in October, November to get their houses inspected and then start having the work done. Some of this work will take longer than other work depending on the amount of lead found in a property, whether it's a house covered in external lead that needs to be encased with some siding, or whether it's a house with just some old windows that need to be replaced. So some of that work can take a week, some of that work can take a little longer. So we're expecting those to come in soon.
The data y'all shared on childhood testing for lead into 2021, can you just speak to, in the years since that, how often are you testing for this and finding it? I mean, once a week, twice a week?
As far as for children,
Yeah.
the way testing your child, it's voluntary unless you're on Medicaid. Medicaid requires you to do it twice before they're 6 years old. But as far as it's not required by most insurances. So we recommend everybody get their child tested, but that's something we can't enforce. But we have been doing that, but we don't have any updated numbers since then.
I mean, we know we regularly test children, and children are regularly referred to us. Public health data, it's sometimes there is a lag time in, because a lot of that's reportable through state data systems or through medical records. So we still have lead poisoned children, but to have that complete data, unfortunately, it takes a year or two, but we still work with them case by case.
From the real estate industry about their ability to comply with this in the next few years?
Sure. I think the main concern we've got is the amount of people who are available to do this work. It has to be done by a company with a certified lead risk assessor. which when this was voted in back in 2022, there were only approximately 30 in the state. Since then, we've trained up to over 100 people to do this work. So we've taken steps to make sure that this work can be done. That's why we're doing the 1-year rollout as well, so they have time and we're not just overtaxing the industry altogether. We want to make sure people have time to get the work done and get it done properly. Any more questions?
Yeah, I mean, I can say where this type of legislation has been created in other metropolitan areas, the overall impact was not to decrease housing availability.
Correct.
So yeah, we did a lot of research before Metro Council put this in.
So if a home is non-compliant, does the city have a way to prevent it from being rented to a family?
Not especially to prevent it to being rented. There will be an open portal for people to go on and see if the house has been inspected, where the lead was found, and what has been done to remediate. We don't have a way to mark a house with a sticker or anything on the front. We're not going to condemn a house. But at that point, like I said, we would go and we would issue citations to the owners to get them brought into compliance. So, but no, we won't be condemning houses or tearing them down or anything like that. Yes, sir.
Will that public-facing portal be available?
I believe it should be available almost immediately. It's just a matter of we have to start getting people signed up for it. We use Excel now, and there's an open. If you log into the city's webpage, you can do a map search of inspections and reports that have come in. But like I said, we haven't had anything sent to us yet. So once we start getting some information sent in, we'll be able to start posting. Yes, Excel is the backbone of it, yes. But it's on our open data portal now. There's a couple different ways we can, or a contractor can do testing, whether it's with a disposable sprayer, or we actually have our XRF gun, which is the ideal way to check for lead.